If you're aiming for 100% disability, then this video is for you. Tip number 1, have a strategy. Making all kinds of claims and seeing what sticks is not the way to go about reaching 100%. In fact, I would actually argue that you're just delaying your final rating and also delaying other claims that veterans send in. When you submit a claim, be sure to have medical evidence. In a perfect scenario, medical evidence looks like a diagnosis. It looks like the veteran going to talk to their doctor about how these symptoms affect their day-to-day life. And depending on what the claim is for, you may even want to submit a Nexus letter up front as you submit that claim. If you're interested in Nexus letters, check out the card up top. Tip number 2, secondary conditions are the secret to 100% VA disability. The VA doesn't want you to know that. Look at your service-connected disabilities, then objectively look at yourself and determine what conditions that you've developed that have stemmed from your service-connected disabilities. You may have tinnitus service-connected at 10%. Well, a month later, maybe a year later, maybe 5-10 years later, because of your tinnitus, you have developed some serious migraine issues. You go ahead, set up an appointment with your doctor, you talk about your migraines, how they affect your day-to-day life, how when a migraine occurs, it's so serious that it causes you to have some serious pain and you have to sit down and stop everything that you're doing while you just deal with your migraine. That doctor may even prescribe you some medicine to help you get through your day-to-day life. If you don't have medical evidence in your service treatment records supporting headaches and migraines, you can go ahead and link your headaches and migraines to your tinnitus disability. Depending on what you're trying to link together, you may also, again, want to consider a Nexus letter. Now, the biggest question is, how do you know which conditions are secondary to which service-connected disabilities? Lucky for you, the work has already been done. There's a subreddit called Veteran Benefits that has laid out all the groundwork for you. All you have to do is join that Reddit. You will have access to the knowledge base. Inside that knowledge base is going to be the master condition list. This master condition list has just about every single VA disability that you can claim. And with each disability, as you click on one, you can scroll down and find common secondary conditions. Card up in the top is going to be a video that lays out step by step how to navigate the master condition list. If you are serious about 100% VA disability, you need to watch and learn how to navigate that master condition list. Tip number 3, and this one is huge. It is absolutely crucial. Do not lie to the VA. Do not over-exaggerate your symptoms. Be honest and be open. It is perfectly okay if you're never going to obtain 100% P&T VA disability. That's okay. There's nothing wrong with that. In fact, a lot of the veterans that are 100% would say that you're the lucky one, that you have your health intact. There's a lot of stuff that you and your family aren't going to have to deal with as you get older, as you go through your life. There is no way, there is no shortcut to 100% VA disability. And if your goal is to lie and cheat your way through the VA system, I'm telling you it's not going to work, and in simple terms, that's just not cool. Veterans have to prove their disabilities with hard medical evidence, and once that's proven, then the veteran has to prove service connection. This video is sponsored by nobody, so please like, comment, subscribe so you don't miss out on all things veteran benefits. Also, if you've reached out to TheCivDiv before, I have went through all my emails, all my messages on Instagram, all my messages on TikTok, and I've tried to respond to each and every one of you. I genuinely enjoy helping out the veteran community. If for some reason I may have missed your response, please, I'm asking you to please reach out to me again. My DMs have blown up after this last month and I've really tried to answer all of you. So again, send me another message if I have not gotten back to you. And if you need some help with your VA disability or taking advantage of your GI Bill or any other VA benefit, go ahead and send me a message and I'll do my best to point you in the right direction. In the description, you'll find the Nexus letter video, you'll find the master condition list video, and if you're in the market for a Nexus letter, you'll also find the information for Access Medical Solutions down below. This is Clay Sims with CivDiv, and today I'm drinking Starbucks.